In an earlier video, we talked about some common compensation patterns in alignment for the pregnant body. So let's just take a quick moment to review. So sometimes we see the hips pushing forward in an anterior pelvic tilt, so I'm tipping my pelvis forward. And sometimes we see the hips pushing forward in a posterior pelvic tilt, or just a lot of gripping in the glutes. As the belly gets bigger, the body's going to try to compensate for that additional weight. We also see what we call common the duck walk of pregnancy, or kind of the waddle. And that could be both legs turning out, that could just be more one leg turning out. So we're going to take a moment and address some poses and exercises that can help this. So we're going to look at poses to strengthen the glutes. We're also going to look at poses to strengthen and lengthen the adductors, and also to strengthen and stretch your piriformis muscle. So let's get a little geeky and just even look at what some of these muscles are. All right, I'm going to grab some props. I love anatomy. It makes me feel like if I'm understanding where in the body I'm talking about, it's easier to understand why and how to strengthen them. So your piriformis muscle goes from your sacrum, that's this bone here in the pelvis, to the greater trochanter. And so I'm just going to use a TheraBand to show that. So it goes from the sacrum to the greater trochanter. And as it gets tighter, it's turning the leg out. So I'll show on my body. So here it is, the sacrum to the greater trochanter. And as it gets tighter, it's pulling that leg into external rotation. So we don't want to just stretch it. Can feel great to stretch it, but we also want to strengthen. So we're going to strengthen some of the muscles that are weaker. So if my leg's always in this turnout, my adductors, my inner legs might be a bit over lengthened and weak. So we're going to work on strengthening this, releasing this, but we also have some wonderful strengtheners to work on the hips so that things are a little more parallel. Now, we don't have an ideal posture in mind. It's not like the days of putting a book on your head and trying to walk, keeping everything straight. We're still living in the body that we've had years of patterns in and compensations. So we want to work with what we have, but we're going to look at where can we find a little more balance. So let's take a look at a few poses that will help strengthen the glutes, strengthen and also lengthen some of your adductors, and release some tension in the piriformis. So we're going to start with a Romanian deadlift. I'm doing it as a kickstand. You could do it with two legs. So let's start. I'm going to show you from the side. So I'm coming knee to knee, and this back leg is like a little kickstand. I'm not putting a ton of weight in it. Now imagine that you've got a 25-pound weight. So think in your mind a little bit of heaviness there. So knee to knee, on the ball of the back foot. Now as I hinge forward, I'm going to show you the common mistakes. I call it pop the booty. Actually, that's what my 10-year-old daughter calls it. Pop the booty, or hunch and round. We don't want either of those. So now imagine you have a yardstick from the back of your head to your upper back to your sacrum. So I've got my imaginary weight. I'm going to hinge forward, reach it towards my ankle, and then as I exhale, press the heel into the floor to come up. So it's a hinge with some imaginary weight, keeping my spine nice and long, my other hand's on my hips. Inhale, exhale, press up. I'll show from the front too. So knee to knee, imaginary weight, hinging back. I've got my imaginary weight. I'm pushing into the floor, very much my heel. Inhale, exhale, press up. I'll also show from this side, so we've got all different angles. So inhale down, nice long spine. Exhale, press into the heel to come up. That's one of my favorite. I put it in pretty much every class. So that's really getting the glutes, getting a bit of the hamstrings. But we still want to get some rotation on the hips. We can get some internal, external rotation, and also work the outer hip. So I'm going to take that foundation and add a fun little twist. So this time, I'm going to take a slightly longer stance. I've still got my imaginary weight. I'm still bringing my other hand to my hip. So instead of just coming straight down, I'm going to twist my upper body a little bit. Fine for pregnancy because I'm twisting the upper body. So I'm going to take my hand to my ankle with my imaginary weight. Inhale, exhale as I come up. Now I'm just opening my hip a little external rotation. Inhale down, press into your heel. Exhale to come up. Let me show you a side version. So I'm still keeping that nice length. A bit of a split stance here. Imaginary weight. Inhale, angling the ribs down, press into the heel, exhale, opening. So I'm letting my hip open it, and I'm slipping a little bit on the ball of the back foot. Inhale down. Exhale, open. So what I love about that, I'm now getting some internal and external rotation. That's going to help for that duck walk situation. All right, so we've got our Romanian deadlift. We've got our rotated lunge. Another one that I want to show you is great still for the glutes, but we're also going to stretch the adductors and give a little strength to it. So this is what I'm calling a lateral lunge. So I'm nice and wide, I'm going from side to side. If you have a light weight, you could use that here in your hands. I like to just use the idea of pressing into the floor like I'm moving through molasses, like I have a little something thicker than air. So I'll sit into one hip. Again, I'm finding that same nice length from my head to my pelvis. Inhale, exhale up to the other side. So I'm really pressing into my feet. I'm getting some length on the inner leg. Inhale, exhale to the other side. Let's look at a side view of that. So I'm reaching the hips back, pressing into the other side. You could alternate your arms if that feels like it gives you a little bit more balance. So now we're just adding to our arsenal of things that are going to help strengthen the glutes, the inner legs. All right, let's get on the floor and we're going to look at one of my favorite to address some of that piriformis tightness. Internal rotation. So we know that when the piriformis is tight, it is externally rotating the legs. So we want to go the opposite way. We're going to do a little internal rotation, but we're not just going to stretch, we're also going to have a little strength. So I'm going to show you two different ways to do this. It's a reverse clamshell. So I'm going to come on to my side. So I've got a block for my head and a block between my knees, and then I've got the additional TheraBand for a little resistance. You don't have to use this at all. You can just think like you're moving through something thicker than air or even using your hand. All right, so I'm coming on to my side and I've got that block for my head. So I'm putting the band around my ankles and then I'm putting the block between my knees. So this leg is actually pretty in line with the hip. Now, if you don't want to use the band, again, think like you're pushing through something thicker than air, or you can use your own hand. And so I'm just going to take an inhale, and then as I exhale, push the heel up. And then inhale down, exhale, find that resistance. So I'm getting this internal rotation while loading the muscle. So I'm getting a little bit of a stretch and some strengthening. Of course, we'd want to do it on both sides. So now to come on to your other side, instead of just rolling over, which is perfectly fine, especially if you're not that pregnant, you can do. But if you're pretty far along in your third trimester, you can come up, come to all fours, and then go the other way, which is also a great way to roll over when you're sleeping. But for the sake of this video, so I don't have my back towards you, I'm just gonna bring myself around. All right, so I'm gonna do the other side. So I have a block under my head, I still have my band and a block between my knees, keeping my hips and shoulders stacked, and I'm just lifting. Inhale, exhale, push up. Again, you can use your hand. I love it. I really feel my glutes wake up because I tend to live in that external rotation in my body, and it's nice to find some strength so I can find ways to help my compensation patterns. Now, while I'm down here, let's do a little bit of a bridge pose. So now I'm just going to use one block. I'll get rid of the strap, come onto my back. Now, if you're in your late third trimester and it does not feel comfortable on your back, we have other ways to strengthen the glutes. We just did a few standing. I'm going to get a little adductor support, a little adductor strengthening by squeezing a block. If you don't have a block, you can blow up a ball, like a small little ball, or roll a towel. Now, your typical yoga bridge, we look for a big back bend. That's not actually what we're doing this time. I'm trying to keep my ribs and my pelvis quite aligned. I don't want to thrust my ribs or crash them down. But I'll think about my tailbone as the thing that is guiding me. So feet are as parallel as it can be. And I'm going to inhale, and as I exhale, reaching my tailbone for my knee pits. So I'm not letting my hips sag. Here I'm in kind of a big arch, nor am I over tucking. But I have a sense of lengthening my tailbone to my knee pits as I squeeze the block. And at the same time, I'm isometrically pulling my heels in. It's a lot happening. My adductors are waking up, my hamstrings and glutes, especially if I pull my heels in, I'm getting that hamstring engagement, which is great if the pelvis tends to tip forward. And I'll take a few breaths here and then lower down. Now, at any point, of course, you can then rest on your side. If you're comfortable on your back, you could take a rest even with a block underneath your sacrum and just breathe for a few moments. And then you can do it again. So those are a couple of my favorite poses for finding some strengthening and lengthening of the inner legs, some waking up of the hamstrings and glutes, so that you can be mindful of your own personal compensation patterns and how we can find a little bit more balance for your pregnant body, which hopefully will lead to a smoother and easier birth.